The broadcast is now starting. All attendees are in listen-only mode.
Well, hello, everyone. Thank you for joining us here today for the Surviving Dual Benefit Year RADV audits during these unprecedented times. I am here. My name is Ray Evans. I'm the Vice President of Sales here with Centauri, and I will be introducing our speaker, Monica Watson, here in just a moment. But I did want to bring up, in looking at the time and going through the presentation, if you have questions throughout the presentation, please put them in the chat. And then what we will do is we will address them at the end of the presentation. And then if we do not get to all of the questions during this webinar, then we will respond to those by email afterwards, in addition to providing a recorded link of this presentation, with one caveat, as long as we don't have any technical difficulties with the recording. So with that, let me introduce to you our speaker today, Monica Watson, who is the Director of Coding Services for Centauri. She has 22 years of experience in the industry, 18 of which has been dedicated specifically to coding. She has designed, built, created coding teams, as well as coding programs and audit programs. She is also an AHIMA approved ICD-10 CM trainer. So I think she will provide you with some tremendous insights and information here in this discussion. So with that, Monica.
Thanks, Ray. Welcome, everyone, and I'm glad you could all attend. I know that we are ticking down the clock to kick off the RADV audits, the HHS RADV audits for benefit year 2019. So I'm hoping that you'll find this information helpful and useful for the first time ever that we're doing two in the same calendar year. So the objectives that we're going to chat about today, we're going to outline the 2021 calendar of events, specifically around the 2019 and 2020 benefit year HHS RADV audits. We're going to discuss some strategies for preparation and success, and then identify perks and pitfalls of having dual audits in the same year. I'll throw it out there. I am not a PowerPoint person in that I put bullets out there, but I will talk a lot about things that may not be word for word in the slides. So I know some of you have heard me speak before and you're used to that, but I just wanted to throw that out there. So our calendar of events. Benefit year 2019 was originally scheduled to happen in May of 2020. And of course, on April 13th, we received memo from CMS that they were postponing the audit due to COVID-19. They did give a target date of August of 2020 to provide a definitive calendar update for the coming activities. They did release that as promised, and on 7/31, we received the true calendar for the 2019 HHS RADV schedule. So samples did release on January 19th, and all of the issuers received that information. And then the package 1 will be due September 1st, with package 2 and IRR on September 9th. Looking at the benefit year 2020, that's going to commence on its normal calendar as we know it today, which would kick off in May of 2021. It will overlap with benefit year 2019 between May and September. The official timeline has not been released, but if we take a look at the last time we did an audit, which was the benefit year 2018, we're estimating that the samples will get released at end of May, and then they'll be due January 10th and January 17th, respectively. They have shared so far that they're not planning to deviate from this schedule. And so obviously keeping an eye on RegTap will be important. This is a quick graphic just to show at a high level how much of the audit actually overlaps, and to talk about some of the activities that'll happen simultaneously while the two audits are ongoing. So for 2019, the wrap up toward that end piece between May and September, chart retrieval will be continuing, coding will continue to occur, appeals for the coding process, reporting, IRR, the creation of the XML files, packaging of the records, and submission of the records. So all those are the activities that happen toward the end of the audit. But while all that is happening at the same time, the 2020 benefit year activities will kick off with the samples being released and reviewed, the discrepancy reporting, enrollment and RxC validation, getting those chase lists created, kicking off chart retrieval, and coding as well. So there's that overlap of closing one and kicking off the other. Let's talk about some strategies for preparation. So I'm sure a lot of us, when we received this information, had a little bit of a scare. We did provide a lot of feedback to CMS about what we thought would be the best course of action. Thankfully, they chose not to do both benefit year audits simultaneously from May to December. But preparing to do two in the same calendar year is going to still require some careful preparation. First and foremost, set up your project plan. What activities have to be done and who's going to be responsible for them? What are your milestones and your deliverables? And the key to this is you're going to have the issuers side and you're going to have the IVA entities side. So there will be key activities for both, and who's going to be responsible for reporting those and meeting those milestones. Milestones are key, and meeting the milestones are even more important if you want to stay on track and on schedule. Estimating the volumes for how many charts you're going to need to do in primary coding and senior coding, and then what kind of IRR are you going to need to do. What's interesting with IRR is CMS has always given us their IRR process, but have also allowed issuers and IVA entities to agree on their own internal IRR process, as long as it achieves the same goal, and then a work paper or a definition is created so that they're aware of how the IRR results were derived. So this is really your kickoff point. Some other things to think about, obviously not really having too much concrete information at the time, is going to be your staffing needs. So how many charts per hour do you expect to do? How many productive hours will the coders have in the day? What kind of training time do you need? Will there be attrition and planning for that? Peaks and lulls in volumes and overlap period. Now, there are a gamut of circumstances out there in the RADV world where some issuers code everything that their IVA entity codes, so that when the results come out, there is a comparison to review. Some of the time, the issuers don't have that staff, and so they only have one or two people who will touch base, and thus the IVA entity has to prepare for these staffing needs. So both models or both circumstances have the same level of importance and the same kind of preparation, because that ultimately the issuer is going to have to oversee what the IVA entity is doing. Planning for charts per hour and productive hours are important because you're always going to have a finite sample of 200 members, at least so far until that changes. But what is key is how many charts are you expecting to retrieve based on how many HCCs there are going to be, and how many hours of a day is a coder truly productive. Most of the time, coders are only really productive 7 hours of a business day because of emails and training and feedback and breaks and that kind of thing. So you want to make sure that the tracking and those milestones are taking into account staying on top of the coding process. Systems are going to be a part of what balances a little bit of what happens in a RADV. Some issuers have internal systems and multiple systems for that matter that they use and IVA entities are going to have the systems that they prepare and they do coding in. Either way, a clear definition of what systems and applications are going to be required in order to conduct the IVA audit accordingly, and getting those set up and configured. Setup and configuration can be as simple as what are we going to do when we receive a chart, and how is the coder going to key that information in. But you also want to make sure that you test and you train everyone on how those systems function, how those systems will be used, who is going to be responsible for maintaining those systems, and then keeping everything working smoothly through the course of the audit. Because one key thing is your system has to be consistent and it has to be available in order to be sure that you can continue to move through the process. Reports are probably going to be of the utmost importance, because you can have all this activity. You can have your project plan set up and all the responsibilities and all the key parties and all the systems and all the productivity plans. But if you can't report on what's happening throughout the course of the audit, you can't track anything else. You can't keep track of KPIs. You have no idea what your coder accuracy is or your validation rates are. So confirming your reports that you need ahead of time. Productivity is a metric that is monitored to determine how many charts are actually being processed in a certain period of time. When you set up those estimates and those milestones, if your goal is to have a certain number of charts captured and coded by 3 months in, so that you have time to review other pieces, then you're going to want that productivity monitored frequently. Accuracy will help toward IRR. Everyone has a different process, but it's best to have IRR conducted simultaneously to the primary coding and the senior coding, so that all it requires in the end is an accuracy or IRR report. But you're going to want to monitor the accuracy throughout the course, because that's going to impact HCC validation. Turnaround times and service level agreements, or SLAs. If you are an issuer that has set some service level agreement requirements with your IVA entity and vice versa, those have to get tracked. So reporting to make sure that those are being met. And the key there is you want to keep coding moving throughout the program so that you can monitor validation and pivot if necessary. So if you see your validation is low, where can you go retrieve more charts? So the turnaround time and those service level agreements are going to help keep everybody moving through the process for the HCC validation piece. HCC validation means different things to different issuers and IVA entities. At the very core of what a RADV audit stands for is the goal, from a coding perspective for the health status validation, the goal to validate that every HCC on that member sample that was submitted on the Edge server can be validated by a medical record. There's a lot that happens behind the scenes to get to that place, but some issuers and IVA entities take the perspective of, if I can just get one medical record that supports that one HCC, I have validated it and I'm done. But some of that actually is a little broader, where certain issuers and entities work together to not only confirm that one time, but every time in a particular medical record or for a particular member, and then anything new, because the goal is accurate capture of HCCs for a particular member and that medical record, and tying it to a claim and getting it in the hands of CMS. So HCC validation reports are going to be the tool, regardless of what your strategy is, to monitor the validation rates that you have, because at a bare minimum, you want to validate what you submitted. But sometimes that means if the record you intended to validate, that HCC, isn't sufficient, you want to have time to chase another record, perhaps. So HCC validation reporting is important and something that should be accounted for. Attestation needs and tracking. So attestations this year are going to be a little different. Benefit year 2019 provided two new things in the protocols. The first one is if you have a medical record that is signature impaired, that HCC is rendered invalid if you don't obtain a signature attestation. But what they have said is that you are able to obtain an attestation from a licensed in the state supervisor of that clinician. So let's say, for example, Dr. Smith was the clinician that rendered the face-to-face encounter for that member on that date of service. They didn't sign their chart, but they're no longer with that practice. If there is a supervisor or a medical director in the practice that is licensed as a clinician in that state, they are eligible to sign an attestation on behalf of that provider. That is something that wasn't able to take place previously. But what they've also shared, and there are still a lot of questions out there about this, is a work paper surrounding the attestation. What we interpret that to mean, and what we understand that to mean, is that should a situation occur where receiving an attestation is impossible, perhaps the provider passed away, or because of COVID, their office is closed, or they had a natural disaster, and there is no way to obtain an attestation, but you made every attempt possible, the ask is that a work paper would be generated to provide the circumstances around that particular impaired record. So there's still a lot more that we are asking of CMS. We've asked several questions, haven't really received anything other than follow what the protocols say. But attestation, the need to obtain one and tracking it through the process could render your medical record valid or invalid. So you're going to want to account for that in reporting. Now, typically attestations are happening later in the process. So this is one of those at-risk activities that could be occurring later in the audit at the same time as you're getting ready to kick off the subsequent benefit year. One of the things that happens also in the reports is just you have a lot of moving parts that you're tracking. And when you start trying to close one audit and kick off another, keeping separation of the data and the reports is going to be important as well, making sure you're reporting off of the correct set of enrollees. Coder education. One of the things that has always been important is coder education to make sure that the validation process is as closely aligned to the expectations of the protocols, but also considers what the guidelines were at the time the chart was coded and submitted. So reviewing the protocols for each benefit year, getting a firm understanding, having the coding guidelines, because with each audit, there is the situation where you have two different ICD-10-CM coding manuals, because on October 1st, the new fiscal year kicks off. So when you're coding for an entire calendar year, so the 2019 dates of service, you're going to be using both the 2019 and the 2020 ICD-10-CM coding manuals. So you want to make sure that all of your staff have access to the books and or encoders and the tools so that they know which book to use, which set of guidelines to use based on the date of service. Previously, there weren't as many coding changes year over year, but we will see more coding changes in these benefit year audits. The program-specific parameters are going to be your compilation, if you will, of all of these items put together. So issuers and IVA entities need to work together on ensuring that everyone understands the expectation for how coders and senior coders are going to review and code the medical records, and that the tool set is in place. Now, bumping between the 2 years, obviously we run into the public health emergency for calendar year 2020, which will come which will kick off in May, and the telehealth and what that means to the HHS RADV. So it's even more important than any other year that this element of coder education is very well handled on both sides. We'll talk about that a little bit more in a subsequent slide. Processes. Again, every issuer and every IVA entity needs to come together to agree on some fundamental processes, and they need to be replicatable. So oftentimes, you know, we'll follow the protocols, but sometimes that's just not enough. Coding abstraction process for how the IVA entity is going to code the medical record. So are they coding all dates of service for all HCCs? Or are they coding only the dates of service that have an HCC for validation and tying it to a claim? So that step-by-step abstraction process is going to be fundamentally important to understanding how the validation is happening and that you're measuring apples to apples. Senior review, are all charts going to go through senior review? Only the ones that are required per the protocol? Are there going to be those plus some of the IRR? So understanding how you're going to identify the charts that need senior review and what that process looks like. We talked a little bit about attestations a moment ago. So attestation management, how are you going to do it? So when an attestation is identified as necessary, who's going to be responsible for chasing it? How is it going to get back into the hands of the IVA entity for review? And then how is that going to get tied to the medical record so that it gets submitted appropriately and tying to the XML? Coder questions. Do you have a process for asking questions, for answering questions, for serving as a resource to each other? And bad charts. There are always going to be situations where a bad chart comes in, whether it's an incorrect member chart, where the scanning was poor, there are black lines through it, half the page is cut off, it's missing a page. So you want to outline a process for identifying deficient or bad charts and getting those replacement charts into the hands of the coders as quickly as possible. And that will hopefully help for validation. So preparing all of this is part of the regular HHS RADV process no matter what happens. But it's a lot of activity to go through, and you have to do it twice. At the beginning of the 2019 benefit year, and then again when we kick off the 2020 benefit year. The reason why you have to do that and why that's important is because there will be differences. So we're going to talk about that in just a moment. Perks. I have to be honest with you, I spent a lot of time trying to think of perks. What are the benefits to having two back-to-back benefit year HHS RADV audits in the same calendar year? And the only thing I could really think of that was a true perk is year-round staff. Now, I'm not sure how every issuer and every IVA entity works, but most of the time, the people that work on this RADV audit they fall into two buckets, right? They're usually people who do other stuff, and then they move over to RADV, and then they go back to their other stuff. Or they're contracted or add-on staff just to cover the engagement of RADV. So if that's the case, it's typically just a 5 to 6 month engagement. But instead, having a year-round situation gives you the consistency of a team for 9 to 10 months. And we all know that risk adjustment is so seasonal. And having the ability to get solid staff, whether they're analysts or reporting people, or whether they're coders or senior coders or project managers, having someone involved that you can leverage for almost a full year is often unheard of in risk adjustment with its seasonality. So that is something that I found to be a strong perk. And of course, training. You invest so much time and energy in training everything we just went over in the preparation process. but now you only have to train one time in the beginning, and maybe just those updates that are different for the benefit year 2020, but you're not necessarily having to start from scratch, oh, by the way, while you're closing one and opening another. So to me, I really tried to think of other perks, but this truly was the one perk, especially in light of how much we lost with COVID-19 and how much impact the coding world and the health plans, how much we lost in our staffing. This is definitely something that I saw to be the perk. Pitfalls. Unfortunately, there were a lot more pitfalls than there were perks, but it's important to know where you have to plan. So the overlap period is going to require a higher volume of resources for a short amount of time. So when you consider the fact that submitting the 2019 benefit year, that's due in September, but the 2020 benefit year, the samples getting released at the end of May, going through June, there's probably going to be the full month of July, perhaps, where there's still a lot of coding activity taking place. So there may be the need to ramp up some resources or to push your timelines back for the 2019 benefit year so those resources can roll into the 2020 benefit year and remain focused. So while one is wrapping up, the other one is implementing. I've said that repeatedly, and I can't emphasize how much that actually means, because you're trying to remain focused on your validations, but you're also trying to make sure that you kick off correctly and smoothly so that the subsequent benefit year audit is as successful. Protocol changes are going to be something that we don't know what to expect, other than we know for certain that the public health emergency with COVID-19 will demonstrate some protocol updates to account for things like telehealth and provider offices being closed and changes in medical care. That's going to require some retraining and some substantial understanding of what that's going to look like. We can't always say that the coding of the records and the audit of the records are going to be consistent. I think if there's anything we can say about the public health emergency and the 2020 benefit year is that there was a good amount of information streaming the whole time so that it was known what CMS was going to accept in the HHS operated risk adjustment program. Competing priorities are always there, but in the first half of the year, when we typically do not have an HHS RADV audit, we're going to see those competing priorities rear their heads. HEDIS, Medicare Advantage sweeps, regular ACA campaigns, Medicaid campaigns, and there's also Con 15 going on right now for Medicare Advantage RADV, which doesn't end until April. So there's going to be the need to prioritize and perhaps understand where there is shared staff. A lot of issuers, again, as I mentioned earlier with resources, share the same resources across these initiatives. And that's going to be a pitfall when you have to consider where you need to place people when in order to meet the goals of each of these competing priorities. Of course, we always talk about provider abrasion and the retrieval side of things, but if we consider for a moment that we're going to be touching providers to say, hi provider, we're doing an HHS RADV audit, we need a medical record for this patient for this full calendar year of 2019 dates of service, and potentially 6 months later calling that provider back for 2020 dates of service. Meanwhile, that provider could also render care to patients in Medicare Advantage and commercial. And so therefore you may be touching the same provider office for the same set of records just for different members during the same time period. So preparing with education for your provider groups, your the resources like your provider support reps, or if you happen to have network operations, keeping them in the loop as some of those resources that you identify in the beginning of your project planning to help providers feel more comfortable. Some of that may also be considering alternate options for them to submit medical records. Maybe they typically have someone come on site, perhaps having the ability to work with your IVA entities to receive records via fax, or perhaps if they're an electronic health record provider, by allowing some tools to pull directly from the EHR. But these are definitely some of the pitfalls where normally we can work around them, but this particular calendar year is going to provide a significantly greater challenge that we did not necessarily expect. How do we know it all worked? How do we know we're doing a good job? How do we know where we stand? Monitoring success is going to require all of the items that we've already talked about culminating through reports, but using the reports and all the things to establish KPIs and just seeing how it went. So when you establish your key performance indicators, some of the things we talked about earlier, HCC validation, productivity, accuracy, and you're monitoring that data frequently, you have the ability to identify early on how successful your audit is going to be or where it's going. You can identify your gaps and opportunities early, almost immediately, and make adjustments to regain your momentum. So typically there, in a regular season where you have your typical calendar of events, it's usually around 6 months. Unfortunately, it always runs right into the end of the year holiday. But what we've learned to do with that calendar is adapt to it and try to make sure that no one's trying to retrieve records after Thanksgiving. So you set your milestones around holidays or other initiatives and push it through. Those are the key performance indicators and the milestones that you're going to want to monitor and keep up with. But if anything fell behind, you could pretty easily scramble and get caught up if it were even possible. Unfortunately, in this situation, there really isn't a lot of room to pause or push back or drop a ball. Ultimately, what's going to happen is if you do that, you're going to end up bumping into the subsequent set of activities. So it becomes ever so important to monitor your key performance indicators and stay on top of them. Coder accuracy and IRR outcomes, that ultimately ends up feeding your overall HCC validation. Monitoring that from day one is going to help understand where you may have some education that has to go back to the coding team, where you may have some coding appeals, where you may have opportunity to improve the validation rates through simple activities earlier on in the process, and monitoring where that sits. So the key theme, if nothing else, through this whole entire presentation is really going to be preparation, organization, and monitoring where things sit. Everyone has a different situation with being an issuer and an IVA entity. Many IVA entities support multiple issuers and have lots of great experience. But this is going to be an opportunity to improve. It's also going to be an opportunity to test those theories if it's your first time, or if it's not your first time, perhaps you're just using a new vendor. We also know that CMS is a good resource. So another thing that's going to be important for succeeding with dual benefit year audits is asking questions. When you have a question, ask CMS. Participate in the monthly meetings. They're not always monthly, but whenever they are on the calendar, they give you the calendar in advance. You can register for those on RegTap, REGTAP. Keeping apprised of any changes in protocols and being able to pivot quickly. All of those are going to help you survive managing dual benefit year audits in the same calendar year. So with that, I tried to give us plenty of time for questions. I didn't see anything come through in the chat. Is there a way to open up for questions, Ray or Gretchen?
You mean unmute everyone?
Yes.
Sure. I believe so.
All right. Anyone have any questions?
They have to unmute themselves, so they've been given access to unmute themselves.
Okay. Quiet group today. As a reminder, you can unmute yourself and ask a question, or you can pop it in the chat box.
Hey, Monica. This is Tammy. I wanted to go back to your attestations and just verify and get just for the clarification of it. You were saying if the providers were no longer in a certain practice, or we can't, you know, maybe they've retired or something like that, but they were tied to a practice or a facility, that there's a medical director that's there, aware of that position practicing there, that we could possibly get them to sign if we cannot get in touch with the original physician that saw the patient.
Correct. That is in the protocols that were released for the 2019 benefit year. They do a pretty good job of defining and adding the caveat that they must be credentialed to practice in that state as well.
Okay, thank you.
My pleasure. Any other questions?
And if anybody's not sure how to unmute yourself, there is a microphone in the top right-hand corner you click on.
Thanks, Ray. I didn't even think about that.
It can get confusing with all the different platforms everybody's using.
Sure. You can also submit a question in the chat box. And if you have a question that you think of later, you can always feel free to reach out and shoot us a message. I believe you would be able to have our email address through where you registered, and we're always happy to follow up and provide answers to questions that you think of later.
Monica, there is a question in the chat. It said, can we register individuals at RegTap or RegTap?
At RegTap, yeah. For some reason, I can't see the chat, the questions in the chat. That's interesting. Yes, you can register individuals to RegTap. So if you go in there, you would register yourself. I believe you do have to tie yourself to an issuer, but you are able to register and go in. And there's going to be a section for the library for HHS. RADV will be your preferred link.
Okay, and then one question is, do we have a slide deck? And yeah, we'll share the link to the recording. It seems to have gone well as far as technical issues. And then there's another question, are we able to code audio only telehealth notes for HHS RADV?
Yes, so one of the things that's different between Medicare Advantage and the HHS operated risk adjustment program, or ACA or HICS, there's a million ways that we call it. Their FAQ is very, very helpful, but in their side, they have aligned more with the fee-for-service expectations around telehealth. And so that does provide more flexibility with using audio only telehealth services in order to validate. But remember, that will only be beneficial for you for the 2020 benefit year. To my knowledge, they have not retroactively made that effective for the 2019 dates of service. So you'll want to find that FAQ. And if you guys are not sure where to find those resources, please do let us know, and we can follow up with you and share that FAQ. If you search on Google or whatever internet browser you use, telehealth for HHS risk adjustment or for Affordable Care Act, it will pop up, and it was updated in August. I did check this week. There are no new updates since then. Any other questions? Unfortunately, Gretchen, I'm not seeing the chats in the chat box for some reason. So I apologize if there are there.
Just the thank you, a couple thank yous.
One last round, opportunity for questions before we wrap up today. Okay, I'll pass it back to you, Ray.
All right, well, very good. Well, thank you everybody for attending. We appreciate your time, especially in these crazy times when everyone's in back-to-backs all the time. Hopefully you found it informative, and look in your email box in the next couple of days. We will send you a follow-up email that will include the link of the recording. And if there's any other questions, you can reply to us. And if you want to speak to us one-on-one, by all means, let us know that as well. With that, we'll wrap up. We thank you again for your time and hope you all have a great rest of your week. And we'll see you out there soon.
Thank you.
Everyone.
Thank you.